I'd like to talk to you a little bit about some things that I've learned over the last year that I was completely unaware of. About 13 months ago, I was diagnosed with stage 4 lung cancer. So what does that mean exactly? Stage 4 cancer means that my cancer had already spread outside of my primary tumor into my other organs. That is the worst stage that you can have. The higher the stage number in cancer, the more aggressive and the more advanced your cancer has become. So about, like I said, 13 months ago in April of 2017, I went to the emergency room, wasn't feeling quite well. I noticed that my arm was dusky, it was swollen, probably can't be very good, and was diagnosed with a blood clot in my neck. So the first question they ask when that happens, it's so rare, is what's making that happen? Underwent a CT scan for them to tell me that I had a mass in my chest that they suspected was not anything good, and I would have to undergo some more tests, and we had to address the blood clot as well. Went to the imaging department, had more CT scans, had more ultrasounds, things like that. Spent Easter weekend in the hospital, and after spending 4 or 5 days laying there, it had come back that yes, this is indeed cancer. I had already suspected that there was probably something going on. I do have a medical background, and was totally shocked that I was even somebody that would have cancer. I have very little family history of that. Lived really pretty healthy my entire life as far as I thought. You know, obviously you can always watch your weight a little bit more, you can exercise a little bit more, you can exude those healthy behaviors, but I knew what those were. And just wasn't anything in me. I was jogging 5 miles a day before this happened. There was just nothing in me that suspected that I would ever be a cancer patient. I had no reason to believe that that would happen. We didn't know at that point in time where my primary tumor was. We didn't know what kind of cancer. We didn't know how far it had spread. Simply that it was cancer, and we needed to get a treatment option going as quickly as we could. Over the next few weeks, they had decided, you know, after looking at more testing and biopsies and things like that, that I did indeed have lung cancer. It had spread really quite far at that point in time, and he said, we need to look at how we're going to treat this and what we're going to do for you. And I said, okay, well, I've already thought about this, and I've decided that I don't want my treatment and my surgeries and radiation and everything that I was going to have in different facilities. I didn't want information to get lost. I had thought all this through by that point in time, and I knew how I wanted to proceed. And when the oncologist looked at me and said, we're not talking about surgery or radiation or anything like that, my immediate thought process went from, okay, I can do this, and you just do what you have to do, to what? Like, I couldn't process what he was even saying to me. And finally, when I call it coming to, when I came back around, I said, you're telling me that I'm terminal, aren't you? And he said, yes. I was not expecting to hear that. It was just such a shock to me. There's no way that you are ever ready to hear those words. You're just never prepared. Totally unexplainable feeling. my entire body just went numb. It was absolutely surreal. What I've also learned since that time is life is totally surreal, and lung cancer in and of itself is just something that is so misunderstood in our society. There's so many injustices that go with lung cancer, and that really is what I want to talk to you about today, my personal experiences with lung cancer. The stigma that goes with it, my hopes is that we can raise awareness for lung cancer and the issues that surround it, and really change our perception as a society and break down some of the barriers that are inhibiting folks from getting quality care and getting the things that they're entitled to when you get a diagnosis called lung cancer. The first problem, the first thing that you think of with lung cancer is you must have been a smoker. That is the first thing that people say to me. Oh, geez, you have lung cancer. You must be a smoker, right? No, I've never smoked a day in my life. That is the first thing that people think of. Now, would it shock you to know that 60 to 65% of new cancer diagnoses are going to come in non-smokers in 2018? That's a shocking number. Think about that, 60 to 65% of newly diagnosed lung cancers are going to be in non-smokers. This is not a smoker's disease. That stigma has had such a negative impact on lung cancer. It really is an atrocity. People they don't understand that you don't need cigarettes to have lung cancer. You need lungs. That's what happens with people. And because of that negative stigma, the funding isn't where it needs to be for lung cancer. Nothing is adequate. It's really the only cancer that has a blame that's associated with it, if you think about it. You would never think of saying to a patient with prostate cancer, geez, you wore underwear that were too tight. Or geez, you have colon cancer. You must have eaten too much red meat. There's not a reason that you would ever associate with a patient getting cancer unless it's lung cancer. We need to stop that as a society. And no doubt about it, smoking is absolutely a risk factor. It is not the only risk factor. And to associate that and somehow blame patients for getting lung cancer, it's a really difficult thing as a patient and as a healthcare provider for people. So when we first got diagnosed, obviously one of the things that you need to think about and decide really rather quickly is what do I do for treatment? I mean, how does this all work? Where do I go? What kind of treatment am I going to get? Do you want Western medicine? Do you want alternative medicine? There's so many different ways to think about it. In the end, we opted to be treated at the University of Wisconsin-Madison at the Carbone Cancer Center, which is a nationally approved comprehensive cancer center. We were blessed enough to be paired with a thoracic oncologist by the name of Dr. Toby Campbell. Not only an extraordinary physician, but just a phenomenal, phenomenal human being. His method of treating patients, we have felt comfortable with from the get-go. His compassion for patients, the way that he deals with us as a patient, you feel like you're the only patient that he has in a day. And to hear him talk and deal with patients every day really has been just another great blessing that we've achieved through our journey. So a few words that Dr. Campbell has shared with us, which I'm really excited to have him share with you.
Hearing that you have a serious diagnosis, something that's life-threatening, something that's probably going to be life-ending, is an awful, awful experience. I suppose it's something that will happen to all of us one day, and yet when it happens, it's almost always a surprise and a shock and an unwelcome piece of information. Part of our job and part of our expertise is in helping people come to terms with and cope with this new reality. For us, I think it's really about a partnership between the patient, the family, the primary physician, and our team, working together to try to find the right blend of medications to control the symptoms as well as we can, while trying to help the patient accomplish their goals. But certainly we want to match our goals with our treatments, with the patient and family's goals for what they'd like to accomplish. And so we spend actually a great deal of time trying to understand where the patient and family are coming from, what's most important, so that we can tailor our treatment approaches to try to help them meet their objectives and meet their goals whenever possible. So we're there to be a guide when that's called for. We're there to be an advisor, a friend, an advocate. We fill a lot of different roles when it's appropriate. And it's incredibly gratifying and rewarding when we can help someone get to that place where they are able to bravely and boldly go forward and make plans and do important things like say goodbye, to celebrate the life that they've lived. Being able to tailor my approach to an individual patient is something that is very important to me and something that evolves over the course of my relationship with a patient. So this journey is not something that the patients go on alone. It's something that myself, but also my clinic staff that works with me, will walk with you day to day, week to week, month to month as we battle the disease and the symptoms that come from it.
There's a whole lot of domino effect that comes with that negative stigma as well. There's no preventative screening for lung cancer right now, for whatever reason. I don't know how to explain that other than the fact that somehow, again, people believe that you somehow deserve lung cancer because of the choices that you've made in your life, which many of us haven't made at all. You get preventative screening from your insurance companies every year via a mammogram, via a PSA test for prostate cancer, via colonoscopies. There is no approved preventative screening for lung cancer unless you are over 55 years old and have a 30-year plus smoking history. It's as easy as an X-ray or a CT scan, and we don't feel the need as a society to provide that to patients. Because of that, 40% of patients that are diagnosed with lung cancer are diagnosed like I was in stage 4. That means that we hold a less than 1% chance of surviving 5 years. Our cancer is so far spread, there's nothing that can even be done about that. Why does that happen? We don't understand that, and it goes back, I believe, to the stigma that's involved with lung cancers. Only 18% of people that are diagnosed with lung cancer are going to survive 5 years or more. If it were caught before it spread, that estimated number would go up to 56%. That is a huge variance in the number because we have no preventative screening in this country for lung cancer. It's a terrible, terrible thing. And it's not like lung cancer isn't common, okay? Keep this in mind. This is shocking to me. Lung cancer is the most common cancer worldwide. The most common cancer. More than 250,000 cases are expected to be diagnosed in 2018. That's a lot of people. That means that 1 out of 16 of us are going to be diagnosed with lung cancer. That's an astounding number. A hugely astounding number. 1 out of 16 of us are going to be diagnosed with lung cancer. On an average, every 2.5 minutes, somebody is diagnosed with lung cancer. Big, big numbers. It accounts for more than 25% of cancer deaths every year. More than half of us diagnosed are going to die within 1 year of diagnosis. I'm one of the lucky ones. I've lived 13 months. Most of us don't. Lung cancer kills more than the next 3 leading cancers combined. It's huge. That's the equivalent of a fully loaded 747 jet falling out of the sky every single day of people dying from lung cancer. 433 people a day are dying from lung cancer. How long do you think it would take to invoke change if that was happening in the aviation industry? One fully loaded jet, 747, falling out of the sky every single day. We don't think anything of that happening with lung cancer. The other problem with lung cancer, because, in my opinion, because of this stigma, is the lack of national funding dollars that are allotted toward lung cancer research. It's the most common cancer. We've just determined that. We've already talked about the fact that it kills more than the next 3 leading cancers combined, yet it receives 6% of the national funding dollars available for lung cancer as compared to all other cancers that are out there. Lung cancer is a big deal. It is not the exception, and it is not a rarity. This happens all the time. 1 out of 16 people. That's huge. The other atrocity is that the gap that we show between the research and the funding is ludicrous. Research is only possible with funding. Until August of last year, there was no money set aside for people to have research done when they have lung cancer because of a genetic mutation. That's what my lung cancer is from. My lung cancer only accounts for about 3% of lung cancer patients that are out there. There's not a lot of us worldwide, but there has never been any funding dollars that are set aside for patients with lung cancer due to a genetic mutation. That's sad at this point in time. We'll show you a link at the end where you can donate for lung cancer research in particular. But these facts, they absolutely have to change. We have to get rid of the stigma that goes with it. This is not a smoker's disease. This is a cancer that is not to be blamed on anybody. We need funding dollars, we need awareness, and we need the negative stigma with lung cancer to stop. Really hard to deal with as a patient. From my personal experiences with lung cancer, it's been quite a ride. There really is no way to explain what happens physically with you. It's changed my whole being. The things that I used to think about, I don't think about anymore, per se. Life as you know it is just gone. It's just different. My spiritual life has changed. My mental life has changed. All that matters to me at this point are the things that I can take with me in my heart, my time with my family and my friends. Having a huge support system is phenomenal. Things that I could easily do 13 months ago, I have no physical ability to do anymore. I'm looking at my last few months of my life right now, and I've not had a successful run on any treatment options that are out there. Those things are coming. They're getting there, unfortunately not fast enough, not something that I'm likely to see with my limited time here, but there's still time to change things for other people. when the oncologist looked at me and said, I give you a 1% chance of being alive in 5 years, I don't ever want your friends or your family members to hear that. That should never be the case. I can't even describe to you the feeling that it gives me thinking that my husband is going to be a widow in his early 40s, because we don't have any means of fixing that with people. It is such a profound disease, how quickly it moves, how it impacts your whole family. My life is just forever changed, and yet I feel so blessed. I feel so fortunate that this is happening to me and not to my family. That really is what all of us wish for. People think that it's prophetic and that it's, profound and I'm heroic, and really not the case. It really is everybody's wish. You don't want your family member or your friends to ever have to live through a cancer diagnosis. Very fortunate that it's me. I know that my God, my higher power, will take care of me, and so I feel very blessed in so many ways to have gotten to walk the journey that I've gotten to walk, and for it to be able to live my life with the clarity that I can have and the peace that I can have in my life, and understanding the things that are important. So although it seems horrible, it really has not been all that bad. My husband may beg to differ. He's got a totally different perspective for you.
What is cancer like from my point of view? Before diagnosis, we found ourselves in the rut of life where we, in our mid-40s, and we're striving to be the best at work, and we're trying to get the house paid off, and now we'll see if we can afford this truck, and we'll work some overtime and we'll take care of it. And we do things with our friends a lot, go out and play some music every now and then. At the time of diagnosis, everything changed abruptly and immediately. Life as we knew it was over. We call it a new normal. It's a different way of living, very different from how it was before. And that normal keeps on changing. We have a new normal probably weekly at this point. When she got diagnosed, it was like getting hit on the head with a huge hammer. And every time we'd make a trip down there, they hit us again with a different hammer. Sometimes it was a small hammer. More often than not, it was a 10-pound sledge that they hit us with. I coined the phrase brain tornado when this first happened. We felt like we had been pushed out of an airplane without the proper instructions how to work the parachute. And that only got worse. We're still trying to find the ripcord. We're having a hard time locating it yet. They gave us a lot of hope at first. 20 years ago, her diagnosis was a 1 year and out. Now, newer medicine and newer practices have made it to where it's a 4 or 5 year. At that point, we felt like we had won the cancer lottery and everything was going to be okay for a while. And our hope was by that time they would have found the magic cure for this thing. Our doctor is a wonderful man. He's very convinced that they will have a cure for this thing in his lifetime, but unfortunately, they will not have it in hers. As we go down this journey, we learned a lot. We learned more about cancer than we ever wanted to know. And we'd like to spread the word a little bit, because before you're diagnosed, you have no reason to think about it or even have it cross your mind. And I hope none of you ever have to realize what it feels like to be sitting in this chair right now. The new normal now is every morning we wake up, we do a personal inventory, and we decide if we should have breakfast or go to the hospital. Her pain management and side effects of the drugs is pretty substantial. Sometimes they're hard to deal with, and every day is different. We have a new normal every week. Hard to explain exactly how it feels to live right now. It's different, and I hope nobody ever has to find this out. People ask, do I think about the end? What am I going to do afterwards? I haven't gotten that far in the process yet. We're so involved in the fight that I haven't had time to think about the end yet. Yeah, it's hard to keep your eye on the ball, but the ball is always in front of you. It's hard to take your eyes off the ball in this case, I guess is a better analogy. And I hope nobody has to sit in this chair.
In closing, thank you for taking the time to listen to my journey and Dan's very unfortunate journey that cancer has placed us on. My goal really is to end the negative stigma that goes with lung cancer and to really change research and funding for folks. Again, I don't want anybody to have to look at their loved ones and say, I was diagnosed with lung cancer in stage 4, and I probably have less than a year to live. That is a horrible, horrible thing. The only way to change that is through education. Please, please educate yourself about lung cancer, and thank you so much for taking the time.